Here for you, a social communication and awareness guide for the Duchenne muscular dystrophy community. This guide is intended for teachers, parents, and friends of people with Duchenne muscular dystrophy. We hope to provide some valuable tips to consider when communicating with people with Duchenne. Overall, we want people with Duchenne to know that they are valuable and that they can really just be themselves. So what is Duchenne muscular dystrophy, or DMD? DMD is an inherited degenerative muscular disease that affects 1 in 3,500 boys worldwide. Boys with DMD lack a protein called dystrophin, shown in purple, that helps maintain muscle cell integrity during muscle contraction. Without this protein, their muscle tissue becomes significantly damaged over time. Most boys with DMD lose their ability to walk between 7 and 13 years old. In their late 20s and early 30s, men with DMD have significant respiratory and cardiac issues that result in their passing. DMD is a physically and mentally challenging disease. A recent study showed that 32% of patients with DMD have ADHD, 26% have learning difficulties, 17 to 27% have an intellectual disability, 27% had anxiety, and 15% have autism spectrum disorder. These mental health issues can make it difficult for boys with DMD to feel comfortable and supported in their everyday lives. So what can we do to help? Current evidence indicates that psychosocial care improves the health outcomes and the quality of life of boys with DMD. Psychosocial care is a culturally sensitive provision of psychological, social, and spiritual care through therapeutic communication. We made an easy acronym to facilitate psychosocial communication and to promote awareness for boys with DMD and their community. It is here for you.
H stands for honesty. Honesty is key to developing trust and open communication. For DMD patients, it's important that you relay your feelings, concerns, and wishes to your family and or caretakers. That way, your caretaker will then acknowledge your concerns and try their best to fulfill your wishes without negatively affecting your health. For instance, if at around 9 or 10 years you wish to be more independent, then tell your caretakers. Tell them that you're interested in cooking or making your own breakfast toast or baking cupcakes. Your caretaker will then ensure that appliances such as the toaster, microwave oven, baking trays, and cutting board, in addition to the right utensils, are within reach. Similarly, if you wish to do your own laundry or learn how to write by yourself without assisted technology, then tell your caretaker so that they can ensure that they have the proper accommodations for you to do so. For DMD parents, though it can be hard to break the news to your child early on that he or she has DMD, it's best not to delay telling them. Make sure that you tell them soon after diagnosis, even though they are 3 or 4 years old. Kids can be very perceptive, but oftentimes they internalize their confusions or emotions and may not ask questions directly. Don't overload them with information, but take it in baby steps as your child develops and grows. For instance, in the very beginning, you can say, Duchenne is the person who discovered Duchenne muscular dystrophy. Duchenne muscular dystrophy means your muscles won't work properly and you may feel weak, but we are working with your doctors to get the best care for you. It's important to know that you did not do anything wrong or bad. This disease happens for many other boys as well, and oftentimes is due to a genetic cause. If you have any questions, please come to me. That way, saying it in a simplistic way and introducing it to them step by step as they grow older will ensure that they understand what they're facing, and also it will help prevent the rise of trust issues or resentment and regret later on in life. Overall, ensuring proper honesty from both the patient and the family will strengthen the family bond and allow for the best communication. Next, E stands for empathy. It's important to empathize with others by putting yourself in their shoes. For instance, make sure DMD boys feel heard and that their concerns are validated. Instead of saying, what is wrong? Why are you acting like this? Say instead, tell me what about the situation is making you feel the most upset. So that way it allows the boy a chance to express his feelings, and he will feel comfortable to do so when someone is actually acknowledging how he feels and they are listening. Next, a guide for teachers to instill empathy in the classroom towards the boy with DMD can include implementing a DMD class activity where kids present on various aspects of what DMD is. It's important for the teacher to consult the parent and the child on the activity beforehand. For instance, a girl in the class can introduce what DMD is and that it means muscles tend to be weaker because they lack an important protein called dystrophin. However, DMD boys still express the same feelings as others, so it's important to respect them. This activity helps ensure other kids don't ask insensitive questions that may seem rude, though not intended. For instance, they may say during recess, "Why are you so slow or weak?" This activity ensures that kids know what DMD is and allows them to develop empathy that prevents them from asking such insensitive questions. Furthermore, it's important to avoid negative connotation phrases such as afflicted by, suffered from, is wheelchair bound, and instead, positive tone words such as progressive muscle disorder, condition affected by, needs the assistance of a wheelchair are better to use. Overall, creating a friendly classroom environment while instilling these important values early on is important. R stands for recognize. It's important for family, community, and the government to recognize the difficulties DMD patients may face and actively help to alleviate them. For instance, DMD boys have a hard time getting up and use the Gowers maneuver to lift their rear end first before using their hands to lift up the rest of their body. Also, DMD boys have a difficult time getting to class because they cannot use the stairs unless use elevators, which can take time, and they may feel lonely by the time they arrive to class. They're the last student to enter. Third, DMD boys may often experience anxiety, stress, or ADHD-related disorders, as mentioned before, and thus they may have a more difficult time writing or taking exams compared to their peers, for instance. It can also be difficult when they enter middle school or high school because they may experience more emotions and stress compared to their peers. So, what can we do to help? Well, assistance with therapists, doctors, teachers, and parents can help alleviate DMD patients' difficulties. For instance, teachers can ensure they minimize activities that require standing up from the ground and instead conduct more classroom activities from the chair. In addition, using technology-assisted devices like a school iPad with touchscreen can help with the fine motor strength and provide voice command and dictation typing systems. In addition, raised desks and/or angle clipboards may make it easier for the child to write. If some of these resources aren't available yet, consider mentioning them during the teachers' meeting and to the principal and school district officials to get funding for these helpful resources. Next, peers can assist the DMD boy class to make him feel less lonely when he arrives at the classroom, and they can also help carry his books. Third, wheelchair companies can recognize and alleviate DMD patients' difficulties by developing cost-effective electric wheelchairs or motor scooters that can help DMD boys move around during late ambulatory stages while providing support for their arms, legs, and spine. It can also make the boy happier that he can move faster than his friends during a race. Last but not least, building ramps for homes, gas stations, and schools is a major benefit for DMD patients that require the use of a wheelchair. Not every place has ramps, so support from the local and state governments can help improve accessibility to all major community places. All these tips will definitely improve the DMD boys' quality of life by minimizing daily challenges they have to face. It's important to recognize that this condition doesn't have to define the entire life of a DMD patient, but they can create something beautiful out of it with the help of the community. E stands for encourage. It's important to encourage DMD and BMD, Becker muscular dystrophy, patients to follow their dreams. Even though DMD boys may experience weakness in their muscles and may not be allowed to play sports like football, swimming has proven to be a more effective alternative activity. A 2018 observational study by Hakan and Tom Turk indicates swimming is beneficial low-intensity recreational activity for DMD boys for the following reasons. Number one, it's a great activity to strengthen the muscles while exerting less pressure on the muscles and joints, especially the hip, ankle, and shoulder joints. Number two, it allows for DMD boys to maintain some physical activity by helping prevent quicker deterioration of their muscles. Three, it also improves social, emotional, sleep, and the overall quality of life, proven by the DMD boys' parents in the study as well. The parents in the study claimed that their kid felt much happier and was able to play alongside his friends in the pool rather than watching from the sidelines. The parents were initially concerned that their kid would never find an activity that truly makes him happy. In fact, the kid was initially upset when he was told by their parents that he could not play football with his other friends. But after several swimming lessons, he found swimming to be really fun and he became overall much happier. This goes to show that DMD boys can still find happiness in a physical activity that is beneficial for them. Furthermore, evidence indicates that physical activity, nutrition, and exercise can overall improve quality of life and help for kids living with physical disabilities. A 2013 study conducted in New Zealand by Hickinson et al. Highlighted that kids living with physical disabilities or autism showed improvement in their 6-minute walk test 24 weeks after the MEND program, which stands for Mind, Exercise, Nutrition, and Do It program. Essentially, this interventional program was designed to include several swimming lessons, painting exercises, nutritional education, awareness guide for kids and their family, and other healthy activities which require the participation of the subjects. This goes to show that healthy eating, physical activities, and mind exercise that promote not only physical health, but also improve mental health and happiness can truly help for those living with disabilities and or autism. Implementing such interventional programs in the U.S. may improve the lives of DMD boys as well. Another 2008 study indicated that physical activity, for instance wheelchair basketball, improved feelings of empowerment and motivation in individuals living with physical disabilities. Well, what do these studies basically show? They show and help prove that physical activity is indeed important in improving the health and wellness of DMD patients, such as swimming and or other aerobic exercises. It's always best to consult your doctor, however, and or physical therapist as to what alternative exercises your DMD boy can do to help maintain muscle activity and to also help improve overall happiness. The main tip for parents and caretakers is that it's important to provide positive support and to let your kid know that he can still have fun, whether it's sports, extracurricular chess clubs, board games, trivia, etc. Furthermore, it's important to encourage your DMD child early on to fulfill their academic and professional goals. Working with speech therapists, career planning center, and helping prepare older DMD and BMD boys for interviews is important, so that way they can be ready like their other peers to complete graduation and find a job of their interest. And working closely with speech therapists over time can help patients get a head start in speaking before they lose their voice as well, due to the eventual loss of swallowing and tracheal muscles. Even though DMD boys experience severe cardiorespiratory issues at around age 18 to 21 years old that result in their passing, nowadays there are many scientific treatments and improvements that are being developed to improve the overall quality of life and lifespan for DMD patients, such that they can live to grow older and find jobs they like. Even though the condition is progressive, providing earlier care to support their future dreams is a very important, crucial consideration. F stands for familiarize. It's important for parents, older DMD boys, and the community to familiarize themselves with the science underlying DMD. Oftentimes, there are key science terms that will appear in scientific literature regarding DMD, ongoing research, and clinical trials. In order to follow along with the latest scientific treatments and trials, or in DMD research conferences and webinars, it's important to understand the following terms such as dystrophin and dystrophin glycoprotein complex, corticosteroids such as prednisone and deflazacort, the fact that DMD is an X-linked gene, what antisense oligonucleotides are and how they relate to exon skipping, hematoxylin and eosin, H&E stains, and last but not least, creatine kinase levels. Dystrophin was already mentioned in the beginning of this video, but here we will briefly go over the rest of these terms to help aid your understanding. First, it's important to note that DMD is an X-linked gene, meaning that the gene encoding for the protein dystrophin, which is the protein that DMD boys often lack, is found on the X chromosome. This means that only mothers can pass this gene along to their offspring, especially if they're a carrier for DMD, meaning that they contain one mutated allele copy for the gene and one normal copy for the gene. When a female carrier mates with a healthy male, there's a 50% chance that they will give birth to a child carrying the mutant copy. If it's a daughter with the mutant copy, then the daughter is a DMD carrier, meaning that she still has one functional dystrophin gene and thus won't experience the severe symptoms of DMD since she can still make the dystrophin protein in the body. However, if the family has a boy with the mutant allele, then that boy will only have one X chromosome from his mother which is mutant and thus will have DMD and experience the severe symptoms. There's still a 50% chance that the parents can also produce children without the mutant alleles, and those children will not have DMD. Overall, it's important to understand that DMD is an excellent gene to understand the results of genetic tests that are commonly done to confirm whether the boy has DMD or not. Furthermore, it's also just helpful to know how DMD is passed throughout the family. Next, it's important to understand what exon skipping means. DMD boys who have severe symptoms because they lack dystrophin, their mRNA reading frame is disrupted, meaning they oftentimes have a deletion that shifts the reading frame. What do I mean by reading frame? Well, analogous to a sentence such as the fat cat ate the rat, if we delete the T in fat, then the rest of the sentence will be disrupted if we read a word as consisting of 3 letters. Similarly here, the reading frame for DMD patients is commonly disrupted because they have usually a deletion in one of their codons, and thus the rest of their sequence is disrupted, and thus their dystrophin protein is commonly truncated, and the important parts of their protein will not be made, and thus that protein cannot bind to the dystrophin glycoprotein complex in the sarcolemma of the muscle membrane, leading to a loss of integrity in the muscle membrane, and thus they will experience muscle weakness. However, antisense oligonucleotides such as golodirsen or eteplirsen skip a certain exon to help restore the downstream sequence, analogous to fixing the rest of the sentence. This exon skipping therapy then allows for the dystrophin protein to be created with the important regions, even though part of the middle is deleted for the unnecessary elements. This exon skipping therapy is a way to reduce the severe symptoms and allows for a more mild Becker-like dystrophy symptom, helping improve the DMD patient's overall quality of life. The graphs below indicate the FDA-approved antisense oligonucleotide drugs. Eteplirsen is a very common one, and that's typically personalized to boys who are amenable to exon 51 skipping, whereas golodirsen, on the other hand, is for DMD boys who are amenable to exon 53 skipping. Such AON or antisense oligonucleotide treatment, in addition to corticosteroids, which will be discussed next, is the common treatment for DMD boys nowadays. More AONs for other exons are currently being developed as we speak. It's also very important to familiarize yourself with corticosteroids, which are commonly prescribed to DMD patients by doctors early on to help strengthen and maintain their skeletal and cardiac muscle function. Deflazacort and prednisone are the 2 commonly used corticosteroids. However, a recent 2020 long-term study by Martin et al. Revealed that deflazacort is a better corticosteroid as it delays scoliosis onset by 2 to 3 years compared to the onset induced by prednisone. Furthermore, deflazacort also delays the loss of ambulation by a few years compared to prednisone as seen in the graphs. Hence, asking your doctor whether deflazacort or prednisone is better for your patient is important. Typically, if the doctor does not bring up deflazacort, make sure you ask your doctor on deflazacort and if that can be prescribed instead. Again, it can depend from patient to patient, so it's always important to check with your doctor. Last but not least, we will briefly discuss the clinical assessment tools used to assess muscle health and function in boys with DMD. A muscle biopsy such as hematoxylin and eosin H.E.R.E stain is commonly done with the patient's consent to observe muscle health. Typically, DMD boys have weaker muscle and larger variation in size of myofibers, or muscle cells, and more degeneration and inflammation as observed by the infiltrating macrophages in the picture shown in purple. Also, there may be more centralized nuclei, also shown in purple, in their myofibers, indicative of constant degeneration and regeneration of myofibers during repeated chronic inflammatory cycles, which is not always good. The pink in the H.E.R.E stain represents the cytoplasm and the myofiber cells. Furthermore, DMD boys tend to have degrading connective tissue and fat deposits and accumulations. Thus, H&E stains are valuable in detailing and assessing the morphology and the physical state of the boy's muscles. On the other hand, creatine kinase levels in the body is easier to obtain from blood tests and is another typical diagnostic tool to assess if the boy has DMD. Creatine kinase is an enzyme in the body and typically stays inside muscles and cells. However, DMD boys experience significant sarcolemmal damage, and thus this enzyme leaks out into their blood in excessive amounts. Usually, the normal range for CK is around 22 to 198 units per liter, but DMD boys tend to have at least 10 times that. And the greater that CK level, that usually indicates the greater the severity of the muscular dystrophy. Again, it's always important to check with your doctor on the normal and abnormal range and to see if a muscle biopsy can be done, as these are valuable tools which aid in the doctor's understanding of how the patient's muscle work, and accordingly the doctor can then provide the right treatment. Now that you understand the basic scientific terms in the DMD community, you're now better prepared to attend DMD research conferences, webinars, and understand the most up-to-date information regarding clinical trials and common assessment diagnostic tools, such as H&E stains and CK levels and genetic testing. If you have any more questions, though, please feel free to ask your doctor, other researchers, or DMD community groups who can help you get in touch with DMD professionals. Furthermore, clinicaltrials.gov is an excellent website to view the ongoing clinical trials related to Duchenne muscular dystrophy or Becker's muscular dystrophy. O stands for optimism. Optimism is key to improving the overall quality of life for DMD patients. There are numerous fun alternative activities that boys and men with DMD can still partake in. For instance, swimming, aquatic therapy, assisted bicycle training, visiting national parks, zoos, and aquariums are just several examples. Furthermore, nowadays there are more accessible-friendly vehicles being developed, which may help DMD or BMD boys with a milder phenotype learn how to drive if they want to. Currently, doctors and researchers are working hard to generate new effective treatments for DMD patients. With next-generation sequencing and other genetic tools and advancements such as CRISPR-Cas9 that allow for better personalized medicine, the future holds great hope for effective treatment for DMD patients.
R stands for respect. Respect is a two-way street. Family and friends of boys with DMD should respect the age-appropriate desire for greater autonomy and privacy. If there are concerns about safety, boys with DMD could be given a medical alert button that could be mounted on the wall in their rooms. Otherwise, parents should always knock when entering their room. It is also important to maintain respectful language that does not infantilize men with DMD or spread other ableist jargon. There are many ableist slurs that were used in medical textbooks as a way to categorize disabled people as inferior. These words are outdated and extremely hurtful. They should never be used, even when a person with DMD or any other disabled individual is not around. Respect goes both ways, though. Boys with DMD should also be respectful of their caregivers' emotions and expectations. Last but not least, U stands for Unite. Unite for change and solidarity. Unite the DMD community to fundraise for research and to implement ramps in rural underserved areas. Interact with advocacy groups like Action Duchenne and Duchenne Coalition via social media to spread the word about DMD and to ensure equity and inclusion for DMD boys in all spaces. We hope that this presentation provided you all with advice and information to better interact with a person living with DMD. Remember that DMD does not define a person, and it does not make someone any less human. Everyone deserves love and care. Thank you so much for watching.